Great. So before we dive right in, we want to know where people are joining us from. To get a sense where everyone is located, please point to where you're calling from on the map. To do this, use the arrow key in the upper left-hand corner of your screen, right above the WebEx presentation you're currently viewing. Click the arrow key and then click on the map where you're located. Great, we have people calling in from all over. I'm located in Boston. We have folks from Georgia, California, Hawaii, Washington State. Awesome. All right, with that, I'll pass the ball on to you, Patty. You can take it away.
Great. Thank you, Naomi, and welcome, everybody. I'm excited to have this group on the call. You are our test run. We haven't had this topic yet, and so we're just really excited to host this call and learn from you all, learn from our community groups, and do a little bit of reconnaissance to see if this topic is of use for you for future calls. So I'm going to quickly run through our agenda, and I just want to point out we have a nice mix of folks from all over. I really want to just encourage you guys to continue to use the chat function throughout the call. We really want to hear from you, so don't be shy. Go ahead and jump in, and anytime if there's a question you can answer on chat, feel free to do that at any time during the call. So let's do a quick run through of our agenda. We're going to talk a little bit about why tracking and measurement matters. So this call is on tracking your influence and impact. How are you making a difference in your community? So why does this matter? And we're going to jump right into exciting community highlight that we have from one of our community members who's doing some fantastic work in Columbia, Maryland. We're going to hear from Audrey Marsh. She is the ministry lead for the Gift of Peace program that is being run out of St. John the Evangelist Roman Catholic Church here in Columbia, Maryland. And we're going to hear a little bit about the work that they're doing in terms of the Conversation Project and some end-of-life panels and presentations that they have. Audrey works really close with the resurrection ministry within St. John's, and because of the work that they're doing, they identified the need for a grief ministry, working on topics that came out of conversations that they were having around end-of-life care. Audrey is a consultant for the Horizon Foundation Speakeasy Howard, and she'll tell you a little bit about that. There is a wonderful collaborative of all sorts of community organizations in Howard County, Maryland, that are working together to get Howard County ready for conversations and respecting patients and families and individual wishes. Audrey also has a fabulous background. She's a retired Department of Defense engineer and computer scientist, and I love that she shares this because she wants to show that all types of people are called to this work, not just religious leaders or healthcare professionals. And I know just seeing from the names on the chat, we've got a lot of folks here from all different walks of life, so I'm excited to get started. After the community highlight with Audrey, we're going to make sure that you guys have time for question and answer, anything you want to ask from her experience. And then I'd really like to open it up to group discussion. So we have folks on the line that I'm sure that we can learn some additional tips and tricks for. So I want to give time, and if you want to share a little bit about what you're doing, what are the challenges that you have around tracking and measurement, we'll open it up and hear from you. And then we're going to walk through a few tools and resources that the Conversation Project has and share a little bit of what folks might be able to do with our tools, and also ask if there's other tools that you all have that could help others. We'll get some feedback and questions, and we have a pretty packed hour. So that's the agenda for today. If there's anything else, I just want to open it up. If there's anything else you hope to get out of the call, feel free to go ahead and chat that in. We want to make sure we're addressing what you came to the call for. So go ahead and pop that in there. We'll see what we can either answer. Obviously we don't have all the answers here at Conversation Project, but we'll see how we can connect you with someone who might have that answer. So feel free to chat in if there's anything else that you really want to tap on today. So let me go, and we're going to go ahead and jump right in. Okay, so why this topic? How did this come up? So on our Community 101 and speaker trainer calls, we have a series of calls every month. We talk about a series of questions for groups to consider when they are designing and planning this work in their communities. These questions, we feel, from the years that we've been working with folks, help bring some focus, some footing, and some efficiency to the work that you're doing on the ground. And this last question here is really what we're aiming on focusing today. So one of the last questions in this series, and I'll go over this quickly, is how will we know if you've reached what you've set out to accomplish? This is all about tracking and measuring progress. So what can you keep track of that will tell you that you've reached your ultimate goal? When we get to this question in some of our previous calls, community groups have really been asking us for more help on this, more ideas on, well, how do we better track what we're doing in the community to really show the impact that we're making on those around us. For those of who haven't had a chance to be on those community calls, I'll do a quick review of some of these questions. I'm not going to linger on that, but I would encourage you to go ahead and join us in June. On June 20th, we have a Community 101 call, and we'll go through all of these questions a little bit more in detail on that call. So let me just quickly run through those now just to give a quick overview. The first question we ask groups to do is really think about who. So it's focused on who do you want to reach? Who is it in your community that you really want to reach with the work that you're doing, and what is it that you want to do to support them? What do you want to accomplish? So these two questions focus on who you want to reach and what goals you might want to set. So what would make you proud? We're really big on having some goals because it gives yourself a little bit of grounding so you can then figure out, well, if I'm trying to reach a certain number of people and I'm hoping that they'll either be aware of the importance of conversations or we hope that they're going to take some action from the events that we plan. If you create some specific goals around this, it helps you plan a little bit better what you want to do. So this third question is, what do you need to get there? This is the activities and the key ingredients that you can then plan on reaching the goals that you're setting up to accomplish. And then lastly, today, this is what we're focusing on here, is all about how do you know if you've reached what you set out to accomplish? So you set some great goals. How do you know you're going to do that? And that's where tracking and measuring what comes in. So before we go into the what and the how, I'm going to pop over into why. So why does this matter? Why should we spend the time on tracking and measuring what's happening? We want to get out in the field. We really want to just present. Why should we do this? So I want to just give you a scenario here. So tracking really helps you see what difference you're making in your community. So here's a typical response that we see to this question of impact and influence. So we reached so many members of our community through numerous workshops and outreach on the importance of advanced care planning conversations with loved ones. Participants said it was great. So now let's add in the types of things that you could track or measure and see what it does. So the same scenario here, and here what we're doing is we're adding in a little bit of things that you can keep track of and measure across your community. So in just 6 months, we reached over 300 members of our community of 2,500 through 20 workshops and 1 sermon on the importance of advanced care planning conversations with loved ones. Evaluations showed that 25 of these members have already had conversations and documented their wishes. Participants said, the fact that you encourage us to talk about and fill out our wishes now, provide the paperwork and a follow-up date to witness the advanced care directive is such a great technique. You make it so easy. You're preventing so much suffering from so many people. You're addressing a need to communicate with my family. So I think this really goes to why it matters. So this is really helping you tell your story better. We are hoping that this combines both the head and the heart. So our work here in the Conversation Project and the work that you're doing in the community is full of heart and full of phenomenal stories. We've heard so many of those from you. That adding this element of tracking some numbers and tracking who you're reaching, maybe the data side of part of that, that's that evidence side, adding that into the stories that you're already collecting and hearing from those communities and those individuals who really this has made a difference for will help you make and create a better impact story, kind of that who and the how together, so it combines that head and heart. It also shows what you're doing is working or not. And this is really important when you are thinking about linking up what you're trying to accomplish, linking your goals up to what is it that you're doing. Are we actually reaching who we want to reach and with the message that we really intend to? So who does tracking actually matter for? So we kind of have the why. Well, who is this for? And utmost important, it's for yourself. So really helping to understand and measure your progress. We know that a lot of you are doing this on a volunteer basis. This may not be your full-time job. It may be something that you're doing on the side. Or you might be an organization that has a limited pool of resources. This really helps you determine the best use of those resources and your expertise and time. It also helps identify where you may need others' help. And so that kind of moves us into who else is it for besides your own group. This is also really important for others. So it creates kind of a push and pull. So that story, think about those two scenarios. The one story really creates more of a impact on who else we might draw in from our community, who else might be drawn to this because of the story that we're sharing. The push out is this is really could be your pitch. So if you think about for those that are looking for funding or those that are looking to promote this, that story will help you create that pitch for funders and for media. So if you're looking to get this in the newspaper, a more robust and full story with some of that data and the heart and the stories that you're collecting will create that bigger picture. And then lastly, this is really helpful for us as the Conversation Project and the wider advanced care planning community. There's many organizations that are doing this. We are one in many, but we are working all together as a collective. As much as you all can help share your story and create that story, we are actually hoping to share and promote your stories wider. So this will help us all see the shift in cultural change that we really seek to attain. And so basically, this is the real big thing on why is this brings joy to your work. And I just love this quote from Henry Ford. So he talks about there is joy in work. There is no happiness except in the realization that we have accomplished something. So really, it's just to emphasize, you all may know that the importance of this, but just emphasizing what this really means when we share our accomplishments. So I want to just take a quick pause, and before we jump into our community highlight, see what's been going on over here in the chat button. Yep, okay, so Carolyn, I heard you looking for slides, and Kate mentioned we're going to send those slides. That's great. So before we jump into the community highlight, just a reminder, we're going to hear from Audrey. I just want to remind all folks to feel free to jump in. If you're hearing questions or things that are resonating with you, feel free to jump in and include that in the chat button. So I want to just pause and see if, I'm not sure we have Audrey on the line yet, but let me just pause. Audrey, are you on with us? Okay. That's okay. I think we're having a little technical difficulties with Audrey, but what I want to do while we're waiting to see if when Audrey comes, I just want to open it up a little bit. As you hear a little bit about why this is important, I'm curious to see, for those that are on the line, and maybe you can just go ahead and chat in, what are you trying to do, or where are you in your program? And are you at the beginning of the program? Are you looking to track and measure? What brought you to the phone call, and what are you hoping to get out that we can maybe address? And so while I'm just giving people a chance, and maybe what I can ask is just to share a little bit for those that are on the line, maybe just back up and ask, what are you doing, and are you new to spreading this in your community, or what type of events are you hosting in your community? So Kate, so great, thanks. Kate is saying she loves seeing how people are using this tracking in grant proposals. Yeah, so this is a big one. We actually hear a lot of folks that are looking for a little bit of funding, some that might be looking for a lot. The funders are really drawn to the story that this tells. So both the data and the stories that you're capturing and the feedback from evaluations really can help boost your position with getting some funding or bringing some partners in. So Regina is telling us that she is doing some in-services with other social workers. Oh, that's great, Regina. I'd love to hear a little bit more. Are you hoping for the social workers to share their story and get comfortable with this, in essence, for them to then share with others? And Ashley is talking about she's using methods to track and measure when an advance directive is not completed at the event or seminar. After community education. This is great. Ashley, we're going to go into this a little bit later about post-event, how folks are tracking and measuring, and I think this is one of the toughest things to nut to crack. Regina, thanks for sharing. She's new to TCP and feel passionate about people getting their desires on paper. This is wonderful, Regina. I'm really excited that you're here to join us. I'm just going to, a reminder for everybody just to type to all participants. Appreciate it. And just one more thing, and I see Audrey has joined us. So one more thing, Nancy R., you're just beginning to measure everything. This is great. You're establishing the benchmark. Nancy, that's actually really critical. I love how you're looking about where do we start and having that benchmark first, and I didn't mention that, so this is a really good reminder. So where are we starting before we measure where we've been? Nancy mentioned she's always capturing the feedback for the next promo. For the next presentation. I think that's great. And we also have some tools on pre-planning. So before you even start this work, what can you do and see who already is having conversations in the community, what they may need. And we've got some examples to share a little bit later on that. Okay, so I think we've got Audrey. Audrey, you here with us?
Yes.
Super. So I am going to move the ball and pass it on to Audrey. Audrey, I introduced you a little bit at the beginning of the phone call. Again, Audrey is the ministry lead for the Gift of Peace at the St. John the Evangelist Roman Catholic Church in Columbia, Maryland. Audrey, we're super excited that you're here to share your example of what's been happening at St. John's and how you're tackling a little bit about tracking and measuring your progress there at St. John's. So let me pass this over to you, and you can go ahead and start up with your slides. So thank you for joining us, Audrey.
Great. I'm starting with just a little bit of background. We have a huge parish. Of the 3,000, about 1,500 is our Hispanic community. We are extremely diverse. You probably would have a hard time finding a parish that's more diverse than ours. We brought in a lot of refugees from different countries over the years, and the parish just had its 50th anniversary. So can't say enough about the diversity and also the educational background. It's highly educated community. So addressing this topic with people who are educated is a lot easier as well, because there's a little more understanding of the importance. Even if it starts out, it's only because of their income and protecting their assets. We recruited through the parish. We had several people join, then kind of intimidated by the level of the work because they had families and other volunteer things. So we had a core team, though, and it was recommended you start with just about 4 or 5 people so that you could really engross yourselves and have the time to put into it. And so myself, with an engineering and management background, so I'm the doer, the put things together, the organizer in the group. We had a former priest. We have our resurrection ministry lead who leads all the funerals and the planning for that. We had a lawyer who was trained in grief ministry, and we also had a nurse who had recently lost her husband within the last year. So all of these people had a specific background that really helped with our team. It helped. It was a good group that worked well together. We started because it was there was a request from a local philanthropic organization, Horizon Foundation, to run a 1-year pilot with IHI. They were recruiting a few churches and a few health organizations and community organizations to try it and see how this worked. So during that first year, we had a lot of guidance also from IHI. Instead of this webinar series, we had in-person events where we got our training. Let's see. So we started out with an initial goal, and our initial goal, because our parish was so big, well, we wanted to get at least 100 people. The brochure you're seeing is this year's. Last year's was a little different and similar, but just a little bit different. We ran 3 workshops last year, and we ran 2 panels that provided information that was supportive to have those conversations. And the main goal of the program was to have and it was the goal of the entire program across the county, was to get people to name their health agent and to have that conversation about their advance directive. For measurement, when we first started out, we were hearing all of this thing about the need to measure, and we were questioning, you know, you're used to measuring health organizations, but what about faith groups? Because health organizations, you can go in and tell people, you have to fill this out. You know, when you're in the hospital, you have to fill it out. When you're in the nursing home, you have to have this paperwork filled out. But when you're in a faith organization, you're recommending, and so you have to win people over a different way, and you have to measure how that works a little differently. So we first tracked the number of people who were attending our workshops and panels. And then after we we waited until the panels and the 2 panels and the 3 workshops were finished over a 6-month period. So we started during the Lenten time frame because we got a late start. We joined a little later than the other groups in the county. And so we were past Sabbath Sunday. We did our Sabbath Sunday around the Lenten time frame and tied everything into that season in our liturgy. And we added at the end in June, that was when we sent out this email through our Sign Up Genius registration. If you were registered, did you have the conversation and name a health agent, or you plan to? The little items we have there on the chart. I plan to have it, name an agent. I plan to have the conversation. I don't plan to do it. I do not plan to do it. That we added that to find out if there were people we were really not reaching. But we also gave people the option of filling out these little cards that just had that on them, and they were anonymous, and they could throw those in the collection basket at Mass during the month of June. We had approximately, across the 5 panels, the 5 presentations, the 3 workshops and 2 panels, we had a total of 900 participants. Some of them were repeats. You know, the same people came to everything. Some people came to one. We didn't worry about that. We worried about how many participants we had total. And then when we looked at these results, we had really good percentages of people who had the conversation and named a health agent. I'm trying to remember the exact percentages because I had them somewhere and I couldn't find them before today. But I want to say it was a good 40, 50%. And similarly to the I plan to have it. And then we didn't have anybody fill in the I do not plan, which was a good sign for us because then at least there wasn't somebody who was obstinate about it. We analyzed written feedback, and this is an example. The next thing is an example of our feedback form. For the conversation workshop, we only had 3 questions for the sake of people who are on the phone. What is one idea or insight from the workshop that is personally meaningful? What aspect of the workshop did you like the best? And in what ways can this workshop experience be improved? For the panels, we added 1 more question Do you have suggestions for additional topics next year? And we were really surprised. The feedback we got was amazing. It was a lot of thankfulness, appreciation, a lot of wows. We didn't realize, just how important this was and how much there was to think about. As far as learning goes, before Sabbath Sunday in the parish, we took a lot of time on the planning, and that was key. There was a lot of, let's say, not fear, but little trepidation that our parish was one of the last ones to actually put our program out there. But we took the time we tried to run pilots, and this is in part of the learning. We discovered the importance of being tied into parish processes and hierarchy. The parish board was not, we sent it to invites to the parish board and different ministries, and we offered 3 times to run pilots, and we had 1 taker because we had gone strictly through the pastor and the priest, and we hadn't gone through the parish board, and they just weren't having it. So we switched to a one-on-one approach, and we recruited a testing group from there's a marriage encounter group that's been meeting together for about 25 years. They work together in a marriage encounter, and they get together once a month for a social, and they have a speaker. So we asked if we could join them. That was amazing. They were the right age group. They came back with really good feedback, and we completely revamped our workshop piece based on their feedback, what they wanted to hear more of and less, and with only changes in some timing that is still standing today. So we're in our 2nd year, and we did 2 more workshops this year. And we added some more timing for discussion. But other than that, that was a paramount part of our piece, was to run that pilot and get really good feedback. We also used the feedback from the feedback form recommendations for topics for this year. And we're doing the same thing for next year. Verbal feedback has been extensive. And this has been really good for gauging how successful we are as well. People we don't know, people we've never known in the parish, have come up to us, just approach us at church and say, "What's next? Oh, I missed one. Will it be repeated? I'm so happy I came." Any chance you videoed the panels? We do not video the workshop, because that's a very personal experience. We do take pictures for publicity, but we do not video anything there. But we did video the panels, and this year we learned from the panels that we still needed more time for speakers. So we had individual speakers once a month from January to June this year. And for those, we do video, and they're available in our Interfaith library for anyone to check out. Feedbacks from the presenters, where we will come back anytime you like. We had a repeat this year. We have an elder care lawyer who's phenomenal, and she's done a different topic each year, and she said she'll do another one next year. We had overwhelming approval to sustain the program in the future. The Horizon Foundation gave us a grant to run the program the first year. So we did offer food for the events that were like right after Mass or right before Mass. We knew the people were going to be gone for, 3 hours or so. We did offer a meal or refreshments based on the timing, and that helped us with that, and it helped us with getting a lot of our materials. So the 2nd year, when the parish was picking it up, we had 2 collections to help with, and we actually had someone donate $500 in memory of her husband, who she said was the ultimate planner. And when she heard about our program, she thought it was a perfect memorial for him. So things like that are really gratifying. Lessons learned and challenges. We learned how key in that base setting the buy-in from the clergy is, because even though we still had the, kind of naysayers on some of on our parish boards, and who are now attending the program, the clergy just jumped in, and they were so supportive. The planning and the practice really paid off. We did not bring in speakers we hadn't heard ourselves. And we made sure that what they were saying tied in to what the message of the conversation project. We tied that into all of our panelists or our speakers. And we made it very clear that it was all tied in and it all had to work together. And of course, the challenge was, really know the inner processes and politics of the parish itself. Our resurrection ministry person was heavily involved in a lot, had been on staff, and we had a former priest from the parish, but at the same time, they weren't clued into some of the current processes. So we did have some trouble with some publicity or something, because when we were a pilot, we were hearing, oh, you're not official. And so the priest being behind us and getting us through those obstacles was paramount. And finally, in this section, words of wisdom. We celebrate, and I'm going to read this for the sake of those who are on the phone. We celebrate our clergy. Their involvement and passion for this effort was key to success. Their recorded homilies are already being shared with other Catholic congregations. We celebrate our congregation. People embraced the workshops and the panels, and they requested more for the next year and again this year. We celebrate personally because we are truly blessed to be in the parish, and our efforts are so appreciated. Our team is known throughout the parish and singled out routinely for thank yous from clergy, staff, and parishioners. We have been blessed. That's all I can say. And our team members have each experienced good deaths, bad deaths. I've experienced 3 that were not good. They were not the way they should have gone. And it was, when I was called out of the blue to do this, I felt like it was meant to be, because it gave me the opportunity to prevent that from happening from someone else. And then part of the Celebrate, I'm providing some of our feedback. And the classic one was, keep as is, can't think of any improvement except maybe next time invite the Pope. Great program. Thank you for bringing this dialogue to our congregation, timely and extremely worthwhile. This 3-part series has been very helpful to me and my family. Thank you. Dying is so complex. Wow. I like having extra copies of the workbook. I have thought extensively about death and after, but not so much about dying. That was really insightful. This answers a real need. One big thank you is hardly enough. And it goes on and on. And other than one comment about starting and ending on time, when we had trouble, one of the masses ran over and we couldn't get into the room in time. So we were running about 15 minutes late. Somebody said, begin and end on time. That is the only request for improvement that we got in all of our evaluations both years. We're probably running I haven't done all the numbers, but we're probably in the 600-700 range so far. We have another program coming up in June. So as far as participants, it's been actually some of the most highly participated ministries in our parish history. So like I said, rewarding. Questions?
Great. Audrey, thank you so much. Let me just first thank you that this is a phenomenal program that's still ongoing. And what I'm taking away from this, and I'll ask as I'm making some comments, if those that are hearing have some questions, go ahead and pop your questions in for Audrey in the chat, and we'll get to you. let me just thank you, because I think what you're telling about is a lot of the key learnings came back from the feedback that you collected from folks, and I think that's what we're hearing. It's not only identifying topics, but you're identifying really what resonates and what matters to people. And as I'm hearing you share the feedback, I can feel the stories that are coming out, and I appreciate the story that you told personally about what this means to you. There's a lot of meaning that's coming out of the qualitative feedback that you captured, but also the numbers, the sheer number of people who are coming back, I think is really exciting. So let me move to Carolyn Grant here. Carolyn says, Audrey, congratulations on such a successful program. Would you be able to provide your materials so I could adapt for my Catholic parish?
Yes, I can provide some materials, and it won't be until June because tomorrow morning I leave for about 2 weeks. But I'm getting it together a packet because I've had several requests, and that was the plan, to share some templates and all for everyone.
Wonderful. Thank you, Audrey. And Kate noted we've got some of them up on our website, and so we will make sure that we get this out, what we have, and we appreciate your willingness to share. Part of what we say at the Conversation Project is that we want people to share generously, and so people can steal shamelessly. So this is all about sharing and networking together, so I appreciate that. If there's, Ashley's noting that she'd like to have them as well, so this is great. It's good to hear what people are wanting. Audrey, thank you so much. If folks still have questions, go ahead and keep them coming, or any comments, go ahead and feel free and pop them in. Audrey, I'm gonna move on just in the interest of time, but we're gonna come back to you if we've got other questions. Thank you very much. So I'm going to ask, Audrey, can you pass that ball back to me? You basically just click on it on your screen and drag it over to me. Thank you very much. Okay. So I'll keep an eye on the chat to see what else is coming through. It's very exciting to hear, Audrey, what you are doing and what the parish is doing in terms of tracking actions and activities. So another question I'm going to pose, and if anybody wants to chat in, let us know how you may be tracking activities and actions. And I'm just monitoring the chat. It seems like some of you that are here are new, so you may not be doing this at all, and that's okay. If there's anybody that some of this resonated and you're doing some programs like Audrey and St. John is doing, feel free to go ahead and pop in what you may be doing. We have a question from Carol. So Carol said, what should we be tracking to show cost effectiveness for a hospital system? Carol, that is an excellent question. This is one that I haven't necessarily seen that come up, but I think what we need to do is take a look at, and I don't know if I have the answer, but I can ask a question that come back to you. So you want to actually take a look at what the cost effectiveness for what in particular, and I would actually ask you to take a look at, is it the cost, what are you trying to see is sharing these conversations, what do you hope to actually achieve? So what kind of costs are you hoping to reduce? And so you might ask some of those questions about what specifically are we going to look at. This is a really huge question I don't have an answer for, but I think this is a really good one, Carol. So if anybody else has experience or is within the healthcare system that's doing something like this, let us know. Carol, we'll have to get back to you on this one because it's a good one. So I'm going to just move us along a little bit in the interest of time. And as Audrey was talking about tracking some of what they're doing, you mentioned 900 participants. I love the fact that you are measuring the percent. So it's not just pure numbers, but you're actually converting that into a measure of how many people are having conversations and have an agent from a result of your program. So that involves looking at the total number that's gone through the program and looking at the number who have reported back to you that have had conversations and converting that. A lot of this takes a good amount of determination to make sure that you're keeping track of this, whether it's paper-based or computer-based, and looking at a tool to try to figure out, well, how many members do we first have coming in through these programs? And we've heard from a lot of folks that they don't necessarily have a good way of tracking the activities and the actions that people are taking. So what we did at the Conversation Project is design a tool that helps to aggregate and collect some of the data and the stories and the lessons and the feedback that you're gathering and put it all in one place. We've sent this out. I'm not going to go over it too much in detail, but I just want to show you where it lives in case you are interested in this tool. We hope it helps those who are looking for a tool. We know one size does not fit all. It's going to depend on what you are hoping to accomplish and what you think you can track. So we hope that this tool can actually provide you with something that you can adapt for your own purposes. And I'm going to quickly share my desktop and show you where this tool lives in our website. Hopefully you guys can see my desktop here. I'm bringing you to the conversationproject.org. We have on the very right-hand side of our homepage a resource center. If you click on the resource center, it'll take you here to our community resource center. If you haven't yet seen this, I encourage you to explore it. If you scroll down, we have under measurement, if you click on this button, it expands the type of tools that we have here. And here under evaluation and tracking, we have an activity tracker. If you click download, it'll take you to the tracker. There's no preview for this because it's not a Word document, it's an Excel spreadsheet. But this tool here, real quickly, let me just show you what it looks like. This is something that we hope would be useful for those that are looking for a tracking tool. You can take it, you can adapt it, cut out what you don't need, add what you do need. There are 3 tabs, one for event tracking. So here, this helps you collect any event you're having, whether it's one event that you're planning on hosting or 5 events. You can put the information about the event, who you're hosting it for, the number of attendees that are at this event, the type of attendee, and any notes that you want to include on here. And then the second half of this tracking tool just talks a little bit about follow-up. So what are you learning? So as Audrey shared, there's a lot of lessons that they've learned from the feedback they got from participants. Here's a place that you can pop it in here or refer to an evaluation form that you may have. So you can fill it out here, and hopefully that'll help you keep track of what you're learning to incorporate back into your program. The second tab of this tool is a monthly total. So we wanted to help provide a way for, if you're hosting events in January, you can quickly add up the number of events and the number of attendees that are attending those events, pop it in here, and so forth for each month. That'll help you aggregate just the totals for the month. And then we added a tab for partners. So if you're looking to keep track of what partners you may be working with or potentially could work with, you do this for volunteers as well. It's just a place to add people's names as you see they may be interested in working with you, and if you're looking to expand this, who might you reach out to? So it's just a tool that could be helpful and that we just wanted to quickly show you. So let me just pause for a second. Let me go see what's happening in chat. Great. So Ashley was answering some of Carol's questions here, so I just wanted to double check and make sure we've got. I'm checking in with everybody on the chat. So thank you, Ashley, for adding in your input here. So the next thing that I want to share is this. So this tracking tool, we hope it helps you organize your work, and hopefully you saw the survey that we sent out. We are, as a group, as TCP, we're kind of walking our talk. We have set up our own goals and making sure that we are tracking the number of engagements. So here on the left-hand side, we are tracking the number of engagements that we are doing in the community ourselves, and that's kind of our primary reach, so the face-to-face engagements that we have, who we're reaching through social media and website, etc. But the most important here for this conversation is We are super interested in what you all are doing in the community. So for those that are starting out new and those that have been doing this for a while, we'd love to hear what you're doing and how you're reaching your community. And we're hoping that tracking tool helps you, and we're hoping it helps us a little bit just to hear a little bit about what you're doing. So on a quarterly basis, we are sending out a survey to you all to kind of track and see what influence your work is having in the community so we can share widely. And so let me go into, let me back up a little bit. That tracking template that I shared is kind of what I mentioned. It's an aggregate, it's a total. It requires a lot of information that you might get at an event or get more specifically. So what we wanted to share with you is how do you get to those totals? So if you are filling in that you have 25 attendees at an event, you need to take a step back and collect some of that information and collect some of that data during an event or an activity that you might be hosting. So we're offering here a few examples of collection methods that you might think about at an event. So during the event itself, you can have sign-in sheets, and that's useful. You can do this on paper. You can do this through, there's some electronic sign-in applications that people are using. That's just a way to get a total number of people that are attending your events and get follow-up information in case you want to follow up with them, get their email and contact information. Some folks are using to track feedback and get instant information at an event. And these sometimes this is for larger events, but they're using some really clever SMS polling. We won't go into that, but if you're looking for more information, we're happy to provide that for you. And then this is a big one, and Audrey mentioned this, is an end-of-event evaluation. So on the spot, collecting feedback as you can, and I would encourage you to do this before people leave the room. You can design a survey, and we have a tool here that the Conversation Project uses for our own events that we have up on our website that you certainly can use. But this is something that we want you to think about what is it that you want to learn and what do you want to track. You can design an evaluation accordingly, so you will be able to capture that learning on the spot. Okay. Okay, so I'm just going to pause and see what's going over in chat here. Ashley, let's see. Ashley's talking, she's asking TCP. So reached via social media. Is that based on, sorry, my scroll, is that based on clicks or likes, or is that people reached, produced by Facebook marketing tool? Great, Ashley, that's a great question. So we, for TCP specific, we are tracking the impressions via social media, and we're making sure via Facebook we are looking at, and Kate is on the line. You can correct me if I'm doing this wrong, but we're looking at those that are engaged on Facebook, the number of I believe the number of new members that we're getting. Oh, sorry. So Kate's answering. Generally, we're looking at folks who are using TCP materials. Sorry, Kate, I'm going to Kate for the wrong question. But so, Ashley, I'll get more details around that. Joanne is asking, she's a Respecting Choices graduate. She's not using TCP materials, but had a major event 2 weeks ago. I love this. Okay, this is a great question, and I see Kate is answering down here. So this survey that I mentioned, we're generally looking for folks that have been influenced and using either TCP materials or the messaging that TCP has. We'd love to see what others are doing, so it's not necessarily limited to that, but we also don't want to claim anything. We're looking to see those that are influenced by TCP, what your events are tracking out there. Okay, I'm looking at time, and I'm going to just jump back to our some other ways that we can track some collection methods and track the activities and the actions that people are taking. So I talked about the event-specific collection methods. This is often one of the hardest nuts to crack is tracking actions people are taking, and Ashley was able to do that through some of the surveys that they were doing. Oftentimes we use post-event specific collection methods to follow up with folks afterwards to see, well, if we're interested in learning and pushing the envelope a little bit, not just creating awareness, but we're really hoping that people are having conversations or filling out advanced directives or talking with their doctors, you can use post-event evaluations to try to collect that methods. This is hard. We recognize that sending surveys out after the fact, sometimes you don't get a good response rate, but there's several different tools that you may be able to use. Here we have a Survey Monkey that the Conversation Project has. It's on our website that you could use, or DAPT. We've got some other examples from other groups to send out what action. It has questions tracking there, what actions people are taking. We also have a lot of good success from groups. One of our groups in Hawaii and one of our groups in Massachusetts are collecting this information at the beginning of a second session. So if you're hosting a one-time event and people aren't coming back, this won't necessarily help you. But if you're bringing people back to a second event, a second session, you can ask them at the very beginning, what are you tracking? What actions did you take since the first event? And you can ask them a real quick question at the beginning. I suggest being creative. This is a challenging one, is how do we actually track this? We have an example here of a whiteboard that one of the congregations in the Howard County work that Audrey's part of, another congregation, is using this and putting this flip chart at the church. And basically, you can't see here, it's a little bit small, but they're asking folks to put sticky dots up to see if they've had the conversation. They put a sticky dot here. If they have filled out their advance directive, they put their sticky dot here, and so forth. So they've come up with some real creative methods, and I encourage you to ask those that you are working with, so the attendees and those that you're trying to reach. Ask them and co-design a little bit with them on what may be helpful and how you might be able to get this information if this is what you want to track. Another way, and lastly, some of you that are starting this out or have been doing this for a little bit are often working with partners. So you may not be the only one who is sharing information at a session. You may have other partners that you're working with that are presenting in the community. So you may want to think about ways to get partner-specific information. So if someone else is presenting, you may want to ask them how many people came to an event. If they're tracking post-event, how many people are taking action. You can use several different types of tools to get information from your partners. You can use have a shared Google Doc or an Excel spreadsheet that you use. We have a member in Massachusetts who has a task force of multiple organizations that are spreading these conversations through multiple events. They fill out a quarterly report on numbers attending and starter kit toolkits that they distribute. And they are using a standard template, so you can create something. We also have some tools that you can use as well. We at the Conversation Project, as I mentioned, the survey, we send it out through a a Survey Monkey. So we're collecting this from you all, but you can use a Survey Monkey with your partners as well. At TCP internally, we track the activities that we're doing on a weekly basis and the learning that we get on a weekly basis. And we use a simple Google form. And our team member fills this out on a weekly basis. So we can keep track of the events that we're attending and events that we're participating in and what lessons that are being learned. So there is a lot of different ways that you can get this type of information. And I know I'm cruising through a lot of different points. And I appreciate that there's a lot of great chat going on in the sidebar here, and so it's really helpful to have you guys list a little bit about what you're doing. What I'm going to ask is, as you all think about ways that you can that you're tracking or better track, we have some resources on our TCP website, as I mentioned. Currently, they live under our resource section under measurement and evaluation here. We are in a total revamp, so we are revising our resource center based on feedback that we've heard from our community, because it's a little wonky right now and not as user-friendly. But as we revise it, we'll make sure we create some additional examples, and we'd love to share some examples from you. So my parting question to you all is if you all have tracking tools to share that have been really helpful and useful for you, we'd love to hear about them. If you have methods that you're using to track that have worked well, we'd love to hear about the methods and the process that you use as well. We hear a lot about challenges, so if you have challenges that you've overcome, we'd love to get any feedback. So I'm going to ask that you all please email me. This is my email here, so pwebster@ihi.org. I would love to get any tools that you're willing to share and network. This is all about community, and we want to just make sure we've got lots of examples for each other. So I'm hoping that you guys can just shoot me an email and let me know what you have. So just in the last 2 minutes, I'm just going to share a little bit of what's coming up with the Conversation Project. We have some, as I mentioned earlier, we have some upcoming community calls. On Wednesday, June 20th, we have our Community 101 call. I know a couple of you, Susan, Charlotte, mentioned you were just starting, and Charlotte, I know you said you had a threefold interest in this work. This call may be, if you haven't already been on it, maybe a good call for you all. And then we've got a call that is for a little bit more seasoned folks, but anyone is welcome to join. In July, we're going to test out a Community Planning 201 call that will take us to the next level. So hear from groups that have been doing this for a while and some tips and tricks that they have come across. And how do we keep this momentum going, because it's not just one conversation, it is conversations over time. And then we've got a call August 15th. I'll talk about this in just a second. September, we have an upcoming virtual speaking call. So real quickly, our call in about the Conversation Project is a really exciting yearly event that happens across the country, and this is an event that happens for a week long, that congregations are focusing on preaching, teaching, and talking about bringing conversations to their congregants. So we hope you join us to hear a little bit more about that if you're interested. I know I'm whizzing through this, and I appreciate you all sitting through this call and measurement. We'd love your feedback. As I mentioned to you at the beginning of the call, this is really a test run for us. This topic has come up a few times. We're testing out this content. I would love to hear what worked, what didn't. As you exit the call, you'll be redirected to a SurveyMonkey. This will help us get your feedback, and in the spirit of measurement about this call, we'd love to get any feedback that you have and how we can improve this for next time. So I just want to say thank you. We are at the top of the hour. We'll send out the slides and the call chat feedback to everybody, and I just wanted to thank everybody for joining us. So thank you once again to Audrey Marsh for sharing their huge success of the Gift of Peace at St. John's, and we hope that you will join us on a future call. So thanks everybody for joining us today.